the heck is a Medicare Supplement Plan and why do I need it? This is video number 5 in a series, Medicare and You Handbook 2020. I read it so you don't have to. All right, we're going to talk about that. The Medicare and You Handbook is the Bible, if you will, that gives you all the information that you really probably need to know or want to, and more than you want to know. But it's something that a lot of people don't read. They get, I mean, it's a government book, for crying out loud. And it's easier to read than it used to be, but it still is a little bit convoluted. One of the questions that continually comes up is, all right, I'm reading about Medicare Supplement Plans, and then I see in another paragraph, Medigap. Well, is that something else? Do I need a Medicare supplement and a Medigap? The short answer to that is no. Medicare Supplement and Medigap are like Kleenex and tissue. They're interchangeable terms, so don't get confused and get bogged down with what are really semantics. The interesting thing I find about the Medicare and You Handbook is Medicare Advantage Plans, which starts on page 55 of the handbook, is 14 pages. Medicare Supplement Plans, also known as Medigap, is 4 pages. Now, anytime you see a difference like that, 4 pages versus 14 pages, you got to figure out that Medicare Advantage plans must be a little more difficult, and that's why they devote more pages to it. Well, that's true. But the next one that's coming up is Section 6 in the Medicare and You Handbook, which is Part D drug coverage, and that's 10 pages. So, between Medigap, also known as Medicare Supplement, and Medicare Part D, you've got almost as many pages as you have for Medicare Advantage. All right, I have a video on Medicare Advantage. That's the Welcome to Medicare Section 4 video. This is Welcome to Medicare Section 5. So if you want to learn about Medicare Advantage plans, look at my video, my other video. And so, that'll give you a lot of information to it. Medicare supplement plans are quite simple because original Medicare is very simple. With original Medicare, if you like your doctor, you can keep your doctor. That's not a campaign promise. That's actually the way it works. There are no networks. There's no managed care. There's no PPO. There's no HMO. There's no POS. There's no EPO. There's none of those 3-letter entities like you see with other managed care plans. It's just you and your doctor. You and your doctor. Insurance company doesn't, or Medicare, insurance company or Medicare, neither one, get to intervene and say, wait a minute, before you do that, you need to give us some kind of documentation so we know that this really needs to be done. It's unfettered access to health care, which is the way life should be. It's completely different from anything you probably have experienced over the last, certainly the last 25 or 30 years. If you go back further than that, we did have health insurance with unfettered access. There was no managed care. We kind of got into it, got sucked into it with now you no longer have to satisfy a deductible, you've got a copay. And I can remember when drug copays first started out for regular health insurance plans, generic drugs were free and brand names were $3. Pretty simple. Well, that party was over real quick. And same thing for doctor visits. Routine doctor visits were $5. I'm dating myself here, but routine office visits were $5. If you went to a specialist, they were either 10 or 15. It just depends. And of course, everything else has increased in price over time. But original Medicare and a Medicare Supplement Plan, also known as a Medigap plan, are very simple, because you don't need a referral. You don't need to worry about, am I over the line and have I gone to see somebody who is out of network, because there are no networks with original Medicare. So how does it work? You go to a doctor files with Medicare. Medicare reviews the claim, they adjudicate it, and they approve it most of the time. If the doctor did his part right, they approve it. Then they send it on to your Medicare supplement carrier. So it's all seamless as far as you're concerned. You don't pay anything. You don't have to pay anything. They're going to ask you, but you don't have to pay anything when you go to the doctor. You really should not pay until Medicare has reviewed the claim and adjudicated it and approved it. Because if they deny the claim because the doctor tried to do something that, well, it's not really going to be covered, then you don't owe for that claim. You don't owe for that office visit or that procedure or that test. There is an exception to that if the doctor gets you to sign a release form saying that, well, if Medicare denies this, you'll pay for it. That's on the spot. That's not one of those generic forms that you fill out when you go to the doctor and says, you have to fill out things to say, has anything changed since the last time we saw you, even though it was only 3 days ago. So it's a little bit different setup. But for the most part, you don't want to pay anything at all when you go to the doctor, even though they're going to ask you for something. Don't do it. I've been on Medicare now for almost 5 years. I have never, ever, ever paid anything when I went to the doctor's office. Never. I've been asked, and I simply say, file with Medicare. We'll let Medicare decide, and then I'll pay you. Okay? And sometimes they put up a fuss, and at least one time I walked out. I said, well, I'm leaving now. And they don't really like that, but tough. This is the way it works. And the reason why you want to do it that way and you don't want to pay is because, again, if Medicare denies the claim, you don't owe it. So if they want to charge you a whopping, $400 for the office visit, and Medicare denies the claim, well, you paid out $400 that you're not ever going to get back. Even if Medicare does approve the claim, if you pay $400 for that office visit, and Medicare just laughs and laughs and laughs, and they say, oh, that's only an $82 claim. Well, again, you've paid money that you didn't really have to pay. So original Medicare and a supplement plan takes some getting used to. I have over 500 clients all over the state. Every one of them have original Medicare and a supplement plan, and they like it that way, and so do I. Well, so that's my deal. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care and have a great day.